Thank you for being here. It's 10:05 here in Fort Myers, Florida. Temperature here is great, so I'm looking forward to this weekend and sharing some time with the family. Well, the reason why we're here, we're gonna talk a little bit about our porcelain veneer masterclass. This step-by-step hands-on experience that we're putting together, and is going to be held in Atlanta, Georgia, so Friday, September 15, or you can choose from two dates. You can either be there Friday, September 15, or Saturday, September 16, and it's going to be held at the Le Meridian Hotel in Atlanta, Georgia. And this is the same hotel. If you were with us a couple of years ago in our bonded functional aesthetic prototype masterclass, is the same hotel, the same venue, very well located, in a beautiful city, very easy to get to, Atlanta, Georgia. So the first thing that I want to share with you is that we have been able to be sponsored, to create this program and have them sponsored by Kerr Restorative, by Oral Arts, and by Romero Dental Seminars. So all of us three came together to put this hands-on experience for you guys. And because of this, because of having such good companies supporting our program, we're gonna be able to provide. It's a 9-hour CE credit during the whole day. So we're going to start 7:30 a.m. We're going to get together, and I'll walk you through the schedule soon, but it's going to be a whole day activity. And the most important thing is that really the activity is very hands-on, and I'll show you the schedule. I'm going to walk you through the schedule of what we're going to do every single minute while we're together. Again, either the September 15 or September 16. We are a PACE, an AGD PACE CE credit provider. So I just wanted you to know that you will come, you will get credits for being part of this webinar. But the most important thing, honestly, is what you're going to take home, what you're going to bring to your practice, what are you going to be able to do in your practice, just the following Monday after you be part of this masterclass with us. So this is a schedule. Again, I said we start at 7:30 in the morning. People are starting coming in at 7:30 in the morning. Registration will be between 7:30 and 8 a.m. And registration, you have to be. Hopefully, you are pre-registered. You just don't show up and try to pay that day, because there is only 15 spots per day. So we're not going to have more than 15 participants. And the reason why we're doing this is because we really want this to be a great experience. We don't want this to be a massive course. We don't want this to be a course where I'm not going to have the time to sit down with you and walk you through one or another step. I want to make sure that I'm there the whole time, that I'm working aside you step by step through the process, that I'm sharing with you my experience, but that I am also there for you if you have any questions, if you have any comments, if there's anything specific that you don't understand, or that you want me to go back and demonstrate. That for me is key, and that's why we have decided, instead of doing one day with more people, we decided to break it down in 2 days, so that we give participants either the option of a Friday or the option of a Saturday. But again, each day is going to be with only 15 participants. We're going to have a lot of help in these rooms. So I mean, everybody's going to be, for sure, is going to be able to have all their questions answered. But I'm going to be there the whole time. So I'm going to be there. And again, with 15 people, I feel very, very comfortable working with. So the other thing that I want you to know is that the cost of the registration for this course also includes breakfast and includes lunch. So once you're there, we take care of you. Okay, so you get there at 7:30 to 8. That's kind of like the registration and breakfast. And then from 8 to 8:15, there's a welcome and course overview. So at the beginning, the first 15 minutes, what I'm going to do is just kind of show you an overview of what you're going to learn. And I'm going to give you a little overview right now of what we're going to try to accomplish, either Friday, September 15, or Saturday, September 16, depending on the date that you choose. After that, from 8:15 to 9:15, it's a 1-hour lecture. So this 1-hour lecture is going to be the clinical sequence, what I call the clinical sequence part 1, which is, I'm going to talk a little bit about case selection. Who are your patients, which are the right patients for porcelain veneers. I'm going to talk about evaluation. How should you evaluate your patients? What kind of occlusion do they have? How much enamel is it present on these teeth? What is the cause, the causing factor why they want to have their teeth restored? Why are you thinking that this may be a good case for porcelain veneers? Is it a attrition case? Is it a excessive wear case? Is it an erosion case? Is it a specifically an aesthetic case? Is it a dark tooth that you're trying to make lighter, to try to blend in better with the patient's smile? Is it multiple diastemas, or the shape of the teeth? What is the reason why you think this patient needs porcelain veneers? The third step is going to be photos, how to document your case as well. And this is important because, again, what we're trying to educate you to have a concept in your practice. And what I want you to do, and what you want to do if you want to take this course, is that you want to try to accomplish, you want to try to be able to provide this care to your patients in your practice. So one of the ways that I have found in my practice, at least, that it makes it so easy for me to kind of walk my patients through the process is just showing them a case. And that's when photography comes into. So, clinical dental photography is very important. I'm not going to go into all the details of how to take, one photo versus the other, but I'm going to give you, the settings that you need to have on your cameras. I'm going to recommend some cameras for you. I'm going to tell you which are the specific shots. And we will give you the literature that you need to take home with you, where it's going to be very easy for you to just go ahead, grab your camera, put the settings that I'm sharing with you, and go ahead and take your photos. Now, these photos, again, are going to be crucial, not only for you to evaluate the case, to sit down and make sure that you're looking at the case correctly, and obviously to walk your patient through the process. And you want to make sure that you take, at least in your first, I don't know, 10 cases, you document them well, because that documentation is going to help you then provide care for other patients. It's going to help you, quote unquote, sell your case to other patients, because it's going to help them understand not only what you can accomplish from an aesthetic standpoint, but it's also going to help them understand why this particular procedure can be considered minimally invasive. Why can you sometimes don't even need to prepare teeth? But if you do need to prepare them, how much do you need to prepare them? And they would be able to see, different cases that you have performed in your practice, and how much you were able to control that kind of preparation for each specific case. We're going to talk about the diagnostic wax up, so important in aesthetic dentistry, because out of your diagnostic wax up, you're going to be able to, to fabricate intraorally your bonded functional aesthetic prototype, which we're also going to talk about shortly. And that's what you see there, wax ups and prototypes. So in that full hour, I'm going to cover all these topics so that we can then go to our first hands-on exercise. And you can see that at 9:15 in the morning, from that day on, we're going to start now our hands-on portion. So very early in the morning, the first 30 minutes, we're going to spend time fabricating our functional aesthetic prototype. And I'm going to walk you through the process, because for me, this is the most important aspect of your porcelain veneer case. Because this bonded functional aesthetic prototype, it actually does what it literally says on its name. It's going to be a prototype. So it's going to be like a temporary solution for their patient. Is going to be bonded, so the patient is going to take it home with them. They're not going to be able to get it, take it out or put it back in. It's going to be bonded to their teeth somewhat permanently. It's an aesthetic prototype because it's going to take into consideration in your wax up every single aesthetic and functional aspect that you should consider. So all that is going to be on this prototype. And then this prototype is going to be worn by them in their house, in their environment, at their workplace, with their wives or spouses and children. Everybody's going to be able to give them feedback. So by getting this feedback, now, not only you're getting the answers to your questions as a dentist, is the incisal edge position correct? Are the embrasures correct? Is the shape and size of the teeth correct? Are they proportionate to the rest of their teeth? Or are they proportionate to the patient's face? How do they look in their smile? And all these questions, are they fracturing? Is the patient that has any excessive wear problems on these prototypes the first 15 or 30 days that they're wearing them? So all these questions, they need to be answered, because these are all functional aspects that you want to make sure that you are choosing the right type of procedure, the right type of restoration for this particular patient. So I love doing my prototypes, because not only that I solve my patient's problem immediately in their first appointment, but also I'm going to get a lot of answers to questions that I know that I'm going to have in the functional aspect of this case with this functional prototype. So we're going to do the hands-on. We're going to tell you how does it work. We're going to show you how to do it. We're going to talk about digital diagnostic wax ups versus analog digital wax ups. I like to do analog, but we also do them digital, and we will share those experiences with you. I know that there's a lot of younger dentists today, and even older dentists like myself, that are doing a lot of digital dentistry in their office. So this is just an easier way and a faster way to get your wax ups completed, and then go ahead from there and take these to the patient's mouth and fabricate your bonded functional aesthetic prototype. So what comes next? So from 9:45, we're done with the prototypes. We're done with that hands-on. We're done with doing a prototype on an actual model. And then we're going to go to our clinical sequence part 2, which is a 45-minute lecture. And it's a 45-minute lecture on what? What are we going to be talking about? We're going to be talking about shade selection. So how do you communicate? How do you know that the shade that you selected is the right shade for your patient? And how do you communicate that shade that you're seeing with your lab, which is so important, because we know we're not going to do these restorations in our office. We're going to have to send this information to a lab. And I personally use a specific lab, and this is the lab that I have asked to support and sponsor our course, which is Oral Arts Dental Laboratories. The reason why I've asked them to be there as a sponsor is because this is the lab that I use, and not necessarily that it is the lab that I recommend. I don't want you to, if you're happy with your lab technician, by all means, you want to keep that relationship. But what we want to do is that we want to try to make sure that you understand the way that I communicate with my lab. Because if you choose the same way of communication, I promise you, it's going to help you just be more successful. You know, this is crucial. It's maybe not that important when you're doing 10 veneers, but it is crucial when you're doing 2 veneers, 1 veneer, 3 veneers. Because again, our goal today, when we're thinking about dentistry, personally, I want to try to be conservative. I want to try to match what God gave this patient. And if I only have to work on 1 tooth because 1 tooth is the only problem, that's the tooth that I'm going to be working on. And I want to make sure that I can communicate well with my lab, and that they can understand what I'm trying to convey shade-wise, shape-wise, texture-wise, in my restorations. So shade selection is critical. Preparation, sequence, and lab communication. You know, how do you go ahead and prepare this teeth? Where do you start? What kind of preparations are you going to be doing? Are all the preparations the same? And they're not. You know, are you going to reduce the incisal ledge? Are you going to keep the canine guidance that the patient currently has? All these decisions you're going to have to make, and you're going to have to make right there then with your patient in the chair. So every single one of these cases have a different type of preparation. And that's why there's been science documenting each and every one of these preparation types. So that's what I want to try to convey with you that day, that day in this short 45 minutes, so that then we can go ahead and do our hands-on actual veneer preparation part 1. And I'm going to call it part 1 because we're actually going to prepare 5 teeth. And we're going to prepare 5 teeth because what I want you to accomplish is I want you to try to accomplish different types of preparations, so that when you're in your practice, you know exactly which one you need to use. So from 10:30 to 12 p.m., we're giving you a full an hour and a half. We're going to prepare tooth number 8 and 9. And you may think that an hour and a half is excessive for that specific part of the course, but it really is not, because I'm going to be working right along you. I'm going to be working side by side with you, and I wanted you to follow every single step. We want to make sure that we calibrate those preparations, and we calibrate them well. Again, the preparation part, it is difficult if you have never done any porcelain veneers. It is difficult if what you do in your practice, like I have seen so many dentists that have done courses with me, that they come and train with us for one reason, because 99% of what they do in their office is a crown preparation. And porcelain veneer preparations and crown preparations are completely different. They're completely different. When you're doing a crown preparation, you're removing enamel, you're getting all the way up to the DEJ, you're actually removing the DEJ, and many times you get into dentin. That is not the case for porcelain veneers. In porcelain veneers, you're trying to stay 100% within enamel. I repeat that again. You're trying to stay 100% within enamel. Now, can you always accomplish that? No. The answer to that question is no. And the other question would be, well, how much exposed dentin would be correct for a porcelain veneer? If I have more dentin exposed, would I have to change the biomaterial that I'm going to use to fabricate my veneers? Again, these are all questions that are going to be answered, because these are true questions. These are questions that we are going to ask ourselves because they are important. It is not the same when you have 40 or 50% of dentin exposed versus no dentin exposed when it comes down to the type of biomaterial that you're going to choose for your porcelain veneers. And this is why it's so crucial that you understand and that you know your lab technician well, because you want to make sure that they'll be able to provide multiple biomaterials for these type of restorations, and not only one. So from 12 to 1, we will all have lunch together in the same hotel. Again, lunch is also provided in this course. And then from 1 to 2:30, we will have our hands-on we will continue with our hands-on porcelain veneer preparations part 2, which is now the preparation of tooth 5, 6, and 7. So, we're just going to go from premolar all the way down to the lateral. So the premolar, the canine, and the lateral incisor. And the idea is the lateral incisor is a very small tooth, so it's a very difficult tooth to prep. The canine is either canine guidance, or you're trying to modify the canine guidance, so you got to understand, or am I going to do a window prep or just a regular incisal reduction prep? And how am I going to prep the premolar? Is it only for aesthetic reasons? Am I trying to fill that buccal corridor with these premolars included in my porcelain veneer case? These are questions that you will have answers. These are questions that I know you have for yourself every time that you're working on these cases. And this is now the third part of our program, which starts at 2:30 p.m. and it goes 30 minutes into a third part of the lecture, which is the clinical sequence part number 3, which is now the fabrication and cementation of temporaries. So one of the most difficult things that I've always been asked is, how do you temporize these minimally or very conservative preparations? And this is what we're going to walk you through during the course. How do you temporize them? How do you cement these temporaries, if at all, if they need to be cemented? How do you keep them in place? How do you prevent your patients from knocking them down and fracturing them? I mean, these are all really valid questions. And again, it's critical, because if your temporaries are over contoured, now you're going to have gingival inflammation. And if you have gingival inflammation, well, how in the world are you planning to cement your veneers, 2 weeks from now? Because again, if you have gingival inflammation, you're just going to be bleeding. And there's bleeding, you're not going to be able to deliver your porcelain veneers. So it is crucial. It is important to understand, how am I going to fabricate my temporaries? What am I going to use to fabricate my temporaries? How am I going to fabricate them? How am I going to bond them or cement them in place so that they are securely in the patient's mouth, and that they can last the time that I need in order for me to send the impression or the scan to the lab and get my veneers back. So that's what we're going to be talking for those 30 minutes. And then we're going to go from 3 to 3:30 for our hands-on fabrication of temporaries right there then in the room. So we're going to have a full 30 minutes to prepare, to kind of deliver, these temporaries, to bond them in place, to trim them, to clean them, to make sure that we're ready to send the patient home with these temporaries. And we're going to do all this on a dentiform. I mean, we're going to have a dentiform the whole morning. We're going to have hand pieces. We're going to have all the burrs. We're going to have curing units. We're going to have every station is going to have everything that you guys need in order for you to work on. The only thing you're going to need to do is to register for the course and bring your loops. Those are the 2 things that you're going to need to do in order for you to be part of this course. Everything else is going to be provided by us to you for you to use that day, and make sure that you, again, understand all the sequence. From 3:30 to 4, we're going to go to the clinical sequence part 4, which is a cementation protocol. 30 minutes, we're going to talk about, how do we deliver these restorations? Who etches the veneer? How do you etch the veneer? How long do you etch the veneer? How do I clean the veneer, if cleaning is even something that I need to do? How do I isolate the area? How do I place a rubber dam? What kind of clamps do I use? Is it important for me to use a rubber dam? How do I prepare the substrate? How do I prepare the tooth? Do I need to do any changes or modifications on my etching protocol? How long do I rinse? What kind of adhesive would I use for porcelain veneers? Is there a specific type of adhesive that I want to be using, or a specific type of bonding system that I want to use? What kind of resin cement do I want to use? Is there any color in the resin cement that I need to be aware of? Is it important for me to have multiple colors of resin cements? All these questions, I know that you have, that I've had myself. And again, we are going to give you a very simplified way of doing it, because I've been doing this for 27 years. I know that I can give you. Now I'm not going to call it a cookbook recipe because it's not, because it's going to be a lot. It's going to have a lot to do with your experience. But I am going to give you some information that is going to be valuable for you to try to simplify your cases and try to keep them as simple as possible. Because I have learned over the years, and I know that the older dentists here with me also would agree with me, is that the more the more that you simplify your procedures, the better outcomes you're going to have. So from 4 to 4:30 we will have our hands-on veneer cementation. Everybody's going to have a porcelain veneer, everybody's going to have a tooth, everybody's going to have cement, everybody's going to be able to walk through the process of a step-by-step bonding protocol so that you know exactly how to bond your veneers when you get back into your office. And from 4:30 to 5, it's the final Q&A. Any questions that you may have during that day, anything that you felt that was unanswered, we will make sure that we'll give you all the information you need before we send you back home. And then the following morning, on Saturday, September 16th, we will do the same thing with group number 2. So this is the way that I have put together the schedule. I just wanted to share the schedule with you because there's a reason why it's been made this way. And I just want to quickly share with you just a quick case. I'm not going to go through the whole process of the case because we don't have the time. I want to answer any questions you may have. But again, I just want to show you kind of like what the idea is. You have a patient like this, they come to your office, they want to close the diastema, they want to remove the midline composite, the composite they have on 8 and 9. You can see the staining of the composite on tooth number 7. And we want to try to maintain the same width of 7 and 10 and 8 and 9, and try to modify it a little bit, those diastemas, so that we can get the right proportions of these teeth. And again, we did the prototypes. We went ahead and then prepped these teeth. I want you to look at my preparations. These preparations were done through the prototypes. And again, I want you to see all on enamel, 100% enamel, very, very small chamfer finish line, slightly, I mean, right at the level of the gingival margin. Right now, you're seeing the case. The patient is ready for me to obtain an impression. You can see that I've placed my cords. I've retracted the tissue. So I know that my preparations were completed with no cords initially, so that I can go ahead and marginate right at the gingival margin. She's got a very nice and thick biotype, very nice and healthy tissue. So I'm not even worried that I put these cords and I'm going to get any recession after this, because again, the type of biotype that the patient has. But again, I want you to see the preparations on 8 and 9. They are slightly different than the preparation on tooth number 7. You can see that on tooth number 7, I have a little bit of a more defined dog leg or dog elbow. You can see it on that mesial aspect of tooth number 7. And the reason why I have there is because I want to make sure that I have some ceramic supported there, because I need to close that diastema. I also have the same between 8 and 9, distal of 8, mesial of 8, mesial of 9, but not distal of 9. So again, very small differences between one preparation and the other. And this all has to do with spacing. This all has to do with proportions. This all has to do with the planning that I had on this case initially. These are my 3 veneers. Instead of doing 4, I decided to do 3 because tooth number 10 was intact. I didn't really have any need to restore. I was trying just to blend everything well from 7 to 9. And again, these are feldespatic veneers. These were done by Oral Arts. I want you to see how thin they are. They're very delicate restorations. These are not type of restorations that are done in any other in any type of lab. Many labs today are just using lithium disilicate for their ceramic restorations, which is a great material. But for other cases, I need something like this. This is a hand sculpt porcelain veneer done on a refractory die using feldespatic veneer, using a powder in a liquid. So they just mix this together, and it really, we need an artist in order for us to give us this type of restorations. Look at the texture, and again, just the overall aspect of the restoration. Isolation is also key when it comes down to the bonding of these restorations. We want to make sure that we have a good and isolated operative field. There's multiple ways of isolating a case for bonded veneers. This is one of them. This is called a split rubber dam technique that we are going to teach you how to do. And again, just for you to have control of the operative field. If something falls from your hands, it doesn't fall in the patient's mouth. It falls on your rubber dam. But you can see how good of a control of the operative field I have. These teeth already have been etched, and the adhesive has been applied. I'm just ready to deliver my restorations. I did the trying. I used the different cement colors, and I decided which color of cement I was going to use. I'll talk about that once we are in our course. But you can see the before and after. This after photo was taken 30 days after delivery of the veneers. You can see the bio integration, how beautifully the tissue was able to then cover that area of tooth. You cannot see the area of the tooth that was not prepped, that you were seeing when I had the tissue retracted. The tissue has come down. These veneers literally appear that they're coming down from the gum line, from the gingival margin, all the way down to the incisal edge. And again, it's just about, it's all about looking at the details. Now, before I get to your questions, and again, if you have any questions, this is the best time to start writing them in the Q&A box, because I am going to go and answer those questions for you in just a couple of seconds. This is my last slide. I just have one more slide to share with you, and this is just good news. This week we were able to, talking with our sponsors, we were able to increase the way that they were sponsoring our course financially, and because of that, we are now giving offerings starting today, and it's only going to be till April 30th. We're gonna start out giving a 20% discount on our early bird. So our early bird was normally $1,800. Our new price is going to be $1,440 all the way to the end of the month of April. So if you want to take advantage of this 20% discount, please go into our webpage. Make sure that you hit our webinar link, and you will find the Atlanta 2023 webinar link there. You can go in and immediately pay through our webpage. Now, this payment goes through PayPal, and PayPal, you can pay with any credit card through PayPal. The reason why we use PayPal is because it's a very secure method of payment. Secure for you. We want to make sure that you trust us. We want to make sure that you feel secure doing this transaction. If for whatever reason you want your money back, you know how PayPal works, and it's very, very secure. That's the reason why we chose PayPal. But when you hit the PayPal button in our webpage, you will be able to choose any credit card that you want. Again, from today, starting today, all the way to the end of the month, you will get the discount.